I said, where it comes to guys are real easy. Testosterone is about strength. It's about, like I've said to many of my customers, testosterone, whatever you associate with being strong and being fast and being able to go and beat up the next male who may have more or less testosterone and mate with the female in the area, that's how nature has it set up. But it's a female that pretty much controls that with the serotonin, letting the male know. Progesterone in breast tissue. If you think of estrogen and the way it locks onto a receptor site and how it stimulates a cell to start dividing, it's saying, we have a chance of getting pregnant. You need the uterus all built up. You need your breasts so you can breastfeed. It stimulates, let's have more growth of stuff, okay? If progesterone wasn't supposed to be part of that, okay? And again, progesterone says go ahead and divide, but do it at an orderly pace. Do it at a regular pace. If that wasn't to be, if nature had not intended that, then the simple presence of estrogen on that cell increases the number of opening receptors to progesterone, okay? So that alone tells you that nature meant to have a lot of progesterone on that cell to control the division. It induces an enzyme that converts estradiol to estrogen. That picture with your three hormones, one being more potent, estradiol, like I said, is a female nemesis. It's very potent. Anything that encourages the conversion of estradiol into anything else is going to lower the stimulation on breast tissue in females. It suppresses estrogen receptors, so too much progesterone around will suppress the number of receptors that are open on the cell to receive the estrogen. Increased programmed cell death. I talked about gene P53 and how it's atopsis, Dr. Ellis, atopsis, the cell death. So, something like that. There's a name for that whole process of when our cells are supposed to die. They're supposed to die when they get freaked out, and they're supposed to die after they've lived past their usefulness. It decreases the amount of prolactin in females. So we know prolactin increases risks of breast cancer. The anti-anxiety reaction of progesterone protects against stress-induced immune suppression. And it enhances the action of the thyroid. We know that's another nemesis of females. A lot of them are thyroid deficient. A lot of patients on Synthroid, a lot of patients on Armour Thyroid. Monthly cycle for a female, again, is the height of estrogen production. Progesterone stays relatively, stable. Then you get into the peak where ovulation happens. A female is very stimulated at that time with estrogen, but progesterone is climbing. Estrogen also increases the amount of serotonin and dopamine in the brain, so the female is happy during ovulation time. With this increasing progesterone going on here, this upward movement is what helps a female to be in that good mood. The estrogen stimulating causes a release of the egg. If the egg ends up passing through and does not get fertilized, progesterone then starts to drop. And then there comes a PMS that's associated with the period that starts. I really only needed to show you one study as far as breast cancer is concerned. Testosterone, there's a few of them. I'm going to go through those real quick. But there's only one for the females as far as breast cancer is concerned. As far as we're concerned, a lot of us anyhow. It was a 15-year study, and the results came out January of 2010 or sometime around there. It involved almost 162,000 women that they followed for 15 years. We were all biting at the bullet to know what these results of this study was going to be. It was called the Women's Health Initiative. Took the 162,000 women, they divided them up into like 3 groups. Okay, one group they gave a capsule that had absolutely nothing in it. The other group they gave just estrogen. The other group they gave estrogen plus progestin. The end result was the females that got the estrogen alone, there was no increased risk of breast cancer. Okay, 162,000 women, third of them in that part of the study, no increase in breast cancer when a female took estrogen. Well, why would you think that? If that was the case, and every time a female was ovulating, nature just doesn't do that. Nature would not risk the female to developing a cancer every time she was ovulating. Estrogen, as bad as it is, unbalanced with progesterone, estrogen by itself did not show an increase in breast cancer risks. The group that got the estrogen and progestin, they actually had to stop that group early because of the increase in breast cancer. The increase was 24%, and it was a more invasive cancer that they saw as a result. Well, I think, geez, you're talking about progesterone. Why would that be? Females getting estrogen, progesterone. The progestin, that's not to be confused with the natural progesterone that a female produces, okay? There's a clear distinction to be made. Progestin, the combination that they used for this study was called Prempro. They don't use Prempro. No doctors hardly write for it any longer. It's Premarin, which a lot of females are on, which is a conjugated estrogen made from horse's urine. And the progesterone part of it is medroxyprogesterone. It looks just like progesterone, and it locks on real nice. It locks on real nice onto that cell, but it doesn't do anything to calm it. All it did was take up the space. So if a female had natural progesterone floating around, it wasn't able to make contact, and the cell wasn't able to be calmed. That in and of itself, if you look at nothing else, that in and of itself, the fact that you were denying the cell progesterone while in the presence of a higher estrogen is enough that our community needs to look at that, And the drug companies are, the mindset is, see, the study showed that women doing hormones, they're going to get breast cancer. Totally false, totally false. Women doing Prempro, yes. So what's the doctor said? Well, okay, we better stop prescribing Prempro. It was I remember when I first started practicing pharmacy, we used to get bottles of 10,000. Every other script we did was Premarin and Provera. Provera is the name for medroxyprogesterone. Every other script, it was the #1 drug in the world, and now it's fallen off. They don't prescribe it anymore. So, to me, the Women's Health Initiative involving that many women and looking at the benefits of progesterone, I think it was shown very clearly in this study. So why the increase in breast cancer? When we get labs, it doesn't matter if it's saliva. I got the saliva kits in my store. You can stop in, you can spit in a tube one morning when you get up. If you're still having a regular cycle, you want to time that on like day number 20 when your progesterone's at its highest. Okay, see if you got a deficiency starting progesterone. So I got those kits. Whether you're spitting in a tube and doing a saliva test or doctors drawing blood and seeing, one of the things that we like to look at right off the bat to kind of assess the risk is your progesterone to estrogen ratio. And the females that I see, this ratio right here, lab after lab after lab after lab, the female's progesterones in many cases are less than what a male has. The deficiency of progesterone is half of it. You can have normal estrogen levels and be deficient in progesterone, and that's danger. You can have normal progesterone levels and have high estrogen, and that's equally as dangerous. So where does all the extra estrogen come from? They're called xenoestrogens, and they're used in a lot of manufacturing. Every time you get new carpeting in your house, that smell that you smell, xenoestrogens. You're drinking water out of a bottle. Plastics is a source of xenoestrogens. The molecule looks like estrogen and has that same kind of stimulatory effect. The new car smell, that's xenoestrogens. And females, of late, because of the abundance in our economy, are getting a new car every couple of years, So how long does it take for that new car smell to go out? How long does it take for those xenoestrogens that are leaching from the dashboard and the foam to eventually leach out to where the female isn't exposed to all this extra estrogen-like material?